Bonjour à tous et à toutes. Nous avons donc rendez-vous ce soir avec le docteur Sigrid Blehle, qui est présente avec nous. C'est un grand honneur de l'avoir avec nous. Elle a une très très grande connaissance de la maladie de Lyme et des autres infections chroniques. Ça tombe bien parce que c'est le sujet exactement de sa présentation. Donc Lyme et les autres infections chroniques, y compris d'ailleurs le Covid long, comment les prendre en charge. C'est un webinaire qui devrait durer 1 heure et demie. Donc, l'idée, c'est de finir autour de 20 heures avec une très brève introduction que je vais faire maintenant pour présenter notamment le docteur Blehle. La présentation du docteur sera l'essentiel, bien sûr, de ce webinaire, avec une durée peut-être d'1 heure à peu près, hein. Il y a beaucoup de contenu. C'est vraiment un gros boulot et il y a pas mal d'informations à récupérer de cette présentation. Et ensuite, nous aurons une discussion libre de petite demi-heure, une demi-heure en gros, questions-réponses. Docteur Blehle, donc médecin généraliste de la clinique Alviasana à Augsbourg, en Bavière, à côté de Munich, à 60 km de Munich. Elle travaille depuis longtemps sur le sujet. Elle a une grande expérience sur la maladie de Lyme et les infections chroniques, je le disais. Elle a notamment été directrice adjointe de la clinique BCA d'Augsbourg, on pourrait dire la clinique historique de Lyme avec le docteur Nicolaus. Elle a fondé cette même année, donc en 2020, à la fermeture de la clinique BCA, une nouvelle clinique qui s'appelle Alviasana, également donc à Augsbourg. Elle la dirige tout en continuant à prendre en charge des patients. Elle était à la tête d'une équipe très compétente sur toutes ces pathologies. Et elle est soutenue notamment par la pédiatre et médecin généraliste, Mme Dr Therezia Heim. Et on peut dire que Mme Blehle a soigné, pour ne pas dire également sauvé, on peut le dire dans certains cas, ça c'est sûr, des milliers de patients. Donc, docteur Blehle, si vous voulez partager votre écran, donc, ça va être en anglais. La traduction automatique, pour qu'elle fonctionne, la traduction automatique de l'oral, il faut que vous alliez, chers amis francophones, sur un bouton qui s'appelle CC en bas de l'écran. En bas de l'écran, ça s'appelle CC, c'est un carré. Il faut cliquer dessus pour avoir le texte donc en français lorsque le docteur Blehle va s'exprimer. Pour le moment, comme moi je l'ai réglé en anglais, excusez-moi, ce que vous avez comme traduction n'est pas bonne pour ce qui me concerne moi, mais c'est pas grave. C'est le docteur Blehle qui va parler maintenant en anglais, qui va être traduit donc en français dans le texte. Pour la session de questions-réponses au passage, n'hésitez pas à utiliser le chat pour lister les questions quand vous en avez. À la fin, à la fin du speech, on fera une petite sélection des questions et je ferai la traduction orale. Voilà. Dr. Blehle, the floor is yours. I think I stop sharing my screen.
Well, just a moment.
And again, warm welcome to you. Willkommen.
Okay.
That's fine. You can put it full screen.
Yeah, just a moment. Okay, that's a full screen. Oh, but
It was full screen, yes, a couple seconds ago.
so I try to do that. Yeah. Okay. So hello everybody. So I'm really nice and it's a big pleasure for me to have this webinar with you. And so I want to go forward. I want to show what we are doing, and then I'm open to your questions. So the title of my lecture is Lyme COVID, long COVID, and post-vaccine syndrome of long COVID, vaccination, and other chronic infections. So that is my declaration. So we will go forward. So it's the first time that I have French slides, so I try to transfer them. So this is my agenda. So we are talking about the comparison of chronic Lyme, post-COVID and post-vaccination. We are talking about diagnostic. I want to talk about the 3I, which is inflammation, infection, and immune system. And then I will also show you if the therapy is not working, what are the reasons for that. And I have also two case studies for you, if we have enough time. So that is post-COVID. So we have in post-COVID, we have a lot of problems. We have a persistence of components of the viruses, but we have also a persistent part of the virus which are inside the body. We have a reactivation of infection, of chronic infection. These are all, on one side, these are virus infection like EBV or cytomegalovirus virus, but on the other side, we have also new infections with Lyme disease or with Bartonella infections. We have a secondary immune suppression. We have some impact on the microbiome of the gut. So the gut is very important. It's a very important part of our immune system. Some we have troubles of coagulation with microthrombosis, which means that you have some coagulation in the smallest vessels. We have autoimmune reaction, and we have chronic inflammation, which we also know from other infections. Then we have this post-vaccine syndrome, which has a lot of the same. This has the same aspects like the post-COVID. And you have to know that in the vaccination, you will get a double dosage. In average, you will get a double dosage of the spike protein compared with a regular infection. Then we have chronic Lyme disease, which is where we know some of the factors of post-COVID, which are similar to chronic Lyme disease. So we have also the presence of infections, not only one. We have also virus infections and parasites. We have inflammation, chronic inflammation. We have also mast cell problems. We have a secondary immune suppression. We have autoimmune reactions, and we have also trouble with coagulations. And this is my definition of the MSIDS. Before we think that Lyme disease and some bacterial infections are this multi-infection syndrome. But my definition is also that we have additionally COVID, we have additionally parasites, and like in chronic infection, we have problems with inflammation and with immunodepression. Then we made tests. We had a lot of patients who had Lyme disease, for example, or we have patients who come to the clinic only for the question about post-COVID or post-vax syndrome. And so we see reactivation of bacterial infections like Bartonella, like Borrelia, other infections like Ehrlichia, Anaplasma, Rickettsia, Yersinia, Campylobacter, Chlamydia, pneumoniae, and Trachomatis, Mycoplasma, Rickettsia, and Brucellosis, Coxiella burnetii. We also know these infections also from chronic Lyme disease. Then we have virus infections like EBV. So most people are talking about EBV virus infection in post-COVID. But we have also varicella zoster. We have cytomegalovirus virus. We have herpes virus, also HHV1 and 2. And we have also Coxsackie virus. Sometimes we have some reactivation of FSME, which is the tick-borne encephalitis. And we also have, we know that SARS-CoV-2 virus can persist in the cells and can persist in patients. We have parasitic infection, which are Bavière and Toxoplasma, and maybe other parasites. I don't know it exactly. Then in the clinic, now the first steps we have to do in the clinic when a patient comes to the clinic. For us, it's very important to do medical history, a really intensive one. Usually we need minimum of 1 hour, sometimes more. We also make a physical examination. And before the patient will come to the clinic, we have a questionnaire about the infections also, and this questionnaire also include long COVID. Then we expect an electrocardiogram, an echography abdominal, and this is also always a challenge for us to look if there are other diseases. So it's a challenge to take care of the differential diagnosis. Then we make some analysis. So we are taking analysis of the blood, sometimes of the feces and also urine. And we are cooperating with several patients nationally and internationally. We are looking for the infections. So these are the tests for the infections. So we are looking for the chronic infections. We are looking for COVID. So we are doing from side of the test, we are doing IgA and IgG, and we are doing the ELISpot. Sometimes we are looking for histamine problems, and we are looking for ATP inside the cell and Q10. If we have some problems with the gut, we are looking also for sonulin, for example, and additionally, we are doing a test of the stool. We are checking vitamin B vitamins. I prefer to check the bioactive B vitamins because we know sometimes you have normal B1 or B2 levels inside the blood, but these are not available for the metabolization of the patients. Then we are doing some tests about the immune system, like CD3, CD56, CD57 cells. Sometimes we are doing some further tests for to exclude rheumatic diseases, for example, or to exclude acute infections. Then the therapy. So the therapy is these are the 3I. 3I means infections, inflammation, and system immunitaire, which means that usually our experience is that you have to do all these three areas. So you have to treat all these 3 areas to be successful. If you're treating only infections, you wouldn't be successful because you have also to restore the body or the metabolization of the patient. So for me, it's very important. I want to show you that these are the question of which kind or which shapes of the Borrelia are available. So usually our aim is to eliminate the Borrelia completely if it's possible, and we are using several ideas on this side. So you see that if you look at the left picture, you will see that the spirochetes, these are the spirochetes which are coming out, for example, from the tick. And in the second picture, you will see these are what's in English? These are the round bodies, and several of these round bodies are on the third picture. And we have to treat also these round bodies because otherwise you will get an internal infection. These round bodies are sitting inside the connective tissue, and you have the problem if you don't treat them that if the patient is feeling good and he has a new problem with the immune system, that these round bodies are coming out, and the Borrelia can go back to the spirochetes. The other thing which is very important is the formation of the biofilms. Today we know that inside the biofilms you can have several kind of bacteria, but it is possible also to have several kind of viruses, maybe parasites. And today we also know that this kind, the several bacteria or the several bacteria which are inside the biofilms, they can also communicate to each other about a chemical way. So it's very important to treat the biofilms and to treat also the several kinds of the several forms of the Borrelia. Yeah. Then, so in the therapy, we have also a biofilm breaker, which is one of the most common biofilm breaker is NAC. We use a combination of NAC, serrapeptase, and berberine to interrupt this communication of the germs inside the biofilm. We try to use the Artemisia or the bical helmet herb. Artemisia is not so easy available in Germany, or it's not available at Germany, so we use the bical helmet. But if you get Artemisia annua, just use it. Then we always use a probiotic because for us it's very important that the gut is in a good shape, because if the gut is not working, you cannot use antibiotic treatment. And my opinion is also that you cannot use herbal treatment if the gut is not working. Inside the gut, we have 80% of the immune competent cells and 70% of the lymphocytes. So it's very important to have a probiotic which has enough germs, like 12 to 24 billions of bacteria and 10 different strains. If we have a problem, if the patient has a problem with the gut, we start to treat the gut first. So because if you have a SIBO syndrome, or if you have a SIBO syndrome, or leaky gut syndrome, you have a problem that some of the symptoms are similar to Lyme disease. If you have leaky gut, so we know that the people could be tired, they have headaches, concentration problems, and sometimes also some joint problems. These are the different antibiotics which are available for the treatment against Lyme disease and the co-infections. So on the left side, you see the penicillins. Usually we are using amoxicillin. Sometimes we are also using the cephalosporins like ceftriaxone and cefuroxime if you need oral cephalosporins. We also, as I told you, I also want to treat, we always treat also some cyst forms. And there you can use Artemisia annua, you can use hydroxychloroquine, which is, and you can use atovaquone. Sometimes you can also use metronidazole and tinidazole, but these two agents, we know that there's suspicion that they are mutagen, so we don't use that. And to treat the intracellular forms, we are using macrolides like azithromycin, clarithromycin, clindamycin. Azithromycin has a nice side, has also nice one further side effect, which is that we know that azithromycin will also destroy the biofilms. Then we are using the trimethoprim and sulfamethoxazole, which is Cotrim or Bactrim. Which is an old antibiotic, but it's still very effective. Then we are using rifampicin or rifampin and rifabutin. The difference is rifabutin is 5 to 6 times stronger than rifampicin. And rifabutin, we use the rifabutin in really strong cases with Bartonella infections. And we are also using the tetracyclines. So we are using the doxycycline, minocycline. So doxycycline more if you have some problems with joint pains and muscle pains, and minocycline if you have some problems with the brain or with neuroborreliosis or neuro-Lyme disease. Lymecycline is also available, but not in Germany. It's only, I know it's available in Switzerland, and it's in between doxycycline and minocycline. Usually you also can use quinolones, but we don't use the quinolones. then I want to talk about methylene blue. Methylene blue is, we use it especially for people who have Bartonella problems. We're using methylene blue as capsules and as IV. And but this is not something which are using in the first row. So we're only using this for people who are, for patients who had passed several other antibiotic treatment or so on, and we have no, and this was not successful. Then we have the disulfiram. The disulfiram is, I think, now it's available, I think, for 5 or 6 years. They started with a monotherapy. You have to start with low dosages, about 50 milligrams, sometimes lower than 50 milligrams, and then you can increase the dosage. And you can also combine it with other antibiotics. I prefer to use a disulfiram as only as a monotherapy, and after that we continue with the treatment of the further infections. Disulfiram has also some side effects like neuropathy, and in high dosages, I have 2 patients here, they use it in high dosage in combination with cannabinoid, and they have some really strong psychiatric problems. So I think you have to be very careful with that. And the dapsone, so this is a big question because we tried also the double dapsone protocol from Horowitz. And it was not in this patient, or in this patients, it was not able to do it on long distance. So we stopped that. And the only thing which is really good with dapsone, you can also use dapsone in combination with other antibiotics. And in these cases, you will see that this improves the effects of the antibiotics. So then I want to talk about the phytotherapy, because my opinion is that some of the patients, you can treat them with antibiotic treatment, but you can also treat them really good with herbal treatment. And at the end of the day, you have nearly the same results. The big difference is that with antibiotic treatment, you need about 8 to 12 months to be successful, and with the phytotherapy, you need 2 or 3 times longer. So one of the things which I really like, as I told you before, is Artemisia annua and the Baikal helmet herb in combination with monolarin. Then I use Polyporus umbellatus, Anthrogravis paniculata, and pamplemousse and ale in combination against Borrelia. And then we use capucine extrait de radis noir for the chlamydia infection. And we also use Rotunia cordata in combination with oregano oil, that is oregano oil, and fenugreek, cyst, which is willow bark, is in it, and pamplemousse to treat Bartonella infections. That's also really effective against that. These are some combination of some agents which I use. And I also use the cryptolepis. I like, so if you have some cyst forms of the Borrelia, cryptolepis is able to destroy them or to move them out of the connective tissue into the blood, which is really nice. And I also use it, it's also effective against Bartonella infections. That's really, and it's the cryptolepis in combination with Artemisia, one of my favorite to use to treat also Bavière infections. Then we have a combination of Sarsaparilla, water yeast, wild card, and coquille de noyer noir, which is effective against Bartonella. And we have some combination where Isat is in it, and Cordyceps, Rotunia scutularia, which is effective against Mycoplasma, against Chlamydia pneumoniae, and it's also effective against against some virus infections. Yeah. These are tinctures, and it is very nice because these are packed as phospholipids, which means these are drops, and it is possible to put the drops under the tongue, and so it's not necessary to swallow them, which is really nice because some of the patients, especially if the gut is not good, they can start with the therapy on this way. Then we have, for us, the natural protocol is really a good alternative. We have some people who don't tolerate antibiotic treatment because it's too strong or you have too much side effects. And usually our experience is also, it is not so heavy, it's not so hard like antibiotic treatment. So we have the duration of the treatment is 2 to 3 times longer compared with the normal treatment. We have a better tolerance, and we have our experience that after 18 to 30 months, you have a result which is comparable with antibiotic treatment. It is also possible to combine both. So sometimes if we have some patients who are really ill, we start with, for example, we start with antibiotic treatment and then we change to herbal treatment, which is also possible. Okay, then we have phytotherapy against the viruses. This is possible. So usually you can use, you can combine Artemisia with vitamin C and leucine. 2 to 4 grams. Vitamin C, the dosage of our vitamin C is about, if I give it as an infusion, it's about 7.5 grams. And but it's also available liposomal, and in liposomal vitamin C, maybe we achieve about 2 grams if you compare it to regular vitamin C. Then we have some combinations against the virus, the herpes virus, which is gingembre, trifala, granate, thyme, zinc, propolis, and balm and green tea. And we have also some combination against the other kind of virus, which is Sureau noir, racine de rose, astragal, oregano, epine vinette, mint to Tibet, ginkgo, and millepertuis. And we have some further thing, which is also this combination is also effective against Coxsackie virus. And we have one further combination, which is effective against Mycoplasma, against Chlamydia pneumoniae, but it's also effective against Coxsackie virus. There is Isatis indigatico, which is effective against Coxsackie virus, and Cordyceps, Rutulia cordata, Scutellea du Baikal, Uncaria tomentosa, Sida acuta, Stilingia sylvatica, and Ova ursi. These combination are also packed as phospholipids. So we have some side effects of the antibiotic treatment, like problems with candida. So for example, we talk to the patients that they show us the tongue, if the tongue is white or sometimes also black. So you have to do something against this. So the first step is also to eat no sugar. Then we are using as antifungal treatment, nystatin, fluconazole, and amphotericin B. But we have also some natural things. One is the extract amer de lavande. This is effective. This combination is effective against the candida. And we have some further thing which is really strong. There is cinnamon in it. There is Stygium aromaticum in it, Altea officinalis, Lapacho, and Tabebua impedignosa, Ulmus rubra, Berberine, Stilingia in it. And this is also packed as phospholipids. Sometimes we have elevated liver enzymes. So that is the reason that we want to see liver enzymes, I think, every second week and with under antibiotic treatment. It is not necessary, usually it's not necessary to do some checks under herbal treatment. That is also one advantage of herbal treatment. And so we are using the milk thistle, and we are using, that is really special, we are doing some compresses on the foie, which, so you take a towel, for example, you put just hand warm water, you put it in hand warm water, and you put it only on the area of the foie, and this works.
Sorry to interrupt, Dr.
Yeah.
Blehle. Is it just a compress with hot water? Nothing inside?
It's nothing inside.
I had a hard time when I translated. So compressive, okay. It's
Yeah.
more or less like a cataplasm when we had, 40 years ago.
Yeah, it's also, there are also some infusions available where you can detox the liver. That's also available. Yeah. And so then I want to introduce you to the treatment intensive personalized. That's our intensive treatment. If someone wants to come to the clinic. So we have really good experience. We don't do that before or in earlier times. We have really good experience to start with 1 week of detox and to add 3 weeks of anti-infectious therapy. This therapy usually can be also a natural therapy. And we usually, so we use, I will show you, we use several kind of treatments. But you have to know that every treatment is adapted to the patient. So we have, so every patient is different, and this is also our problem to do some studies, because nearly every patient is different. So at the moment we have the possibility to, we are using over 100 complements, but not every patient are taking all the complements. But this is the gallery, that is our catalog where we can pick out the right supplements. Then, so in the first week, we start with detox week. So we are doing the detox of the foie and of the nerves. The people will get some amino acids and some vitamins. We are doing really good. We are really good doing good detox with the Me2V machine, because this improves the possibility, or this improves the deliberation of toxins out of the cells. But on the other side, it's also easier to bring some vitamins into the cells. And sometimes we are using also, if it's necessary, we are using also this Me2V machine along with chelation therapy against heavy metals. So in the second...
Sorry to interrupt, Dr. Blehle.
Yeah.
You talked about Me2V machine. So it's a machine which is dedicated to, which is designed to purify the blood. How does it work?
It's the effect of the Me2V machine is that the membrane of the cell is more the membrane of the cell is more open, so the toxins are coming out of the cell on the one side, but on the other side the vitamins are going into the cell, which is also good. Yeah, so then we in the second to fourth week we start with the treatment of the infections. So it depends what patients will show us. So we are treating the parasites on the one side. Sometimes we also started with the treatment of the parasites before the people are coming to the clinic, because it's a good preparation. Usually we start also with the treatment of the parasites. And then it depends from the patient. We are treating the viruses with leucine, with vitamin C, with artesunate IV. Sometimes we are using also some antivirals like ritonavir, and we are treating the bacteria. And it's also dependent which kind of bacteria patients will show me. And then We have this treatment is also possible with phototherapy, and we have also the option to use biophoton therapy, where we can focus on the special infections. So. Then we are doing additionally, the patients will do some hyperthermia. We are using the hyperthermia until 38.5 degrees because we are convinced that this is better for the immune system compared with the hyperthermia until 42 degrees. And the other advantage is that with 38.5 degrees, you can treat also Bartonella if you are doing antibiotic treatment at the same time. With the hyperthermia until 42 degrees, you will get the Bartonella will become more, and you cannot treat the Bartonella infections. Then we are using the ozone therapy. We're using on the picture below, you will see that we will take some blood, we will mix the blood with ozone, and we will reinfuse, we will give it back to the patient. Then we are using also magnetic field therapy. We're using this light therapy, and we have a really good physiotherapist which is working with us. So if someone, for example, is sitting in a wheelchair, and we are also offer the physiotherapy for such patients. Then we are doing the therapy of the secondary immune suppression. So one thing which is really important is to treat the infections. If you are treating the infection, you will reduce the impact of the bacteria to the immune system, so it's really necessary to do that. Yeah. On the second time, you have to take care of the gut, which is important. And we also add some supplements which will support the immune system. The beta-glucans is one thing of that, and medical mushrooms, for example. And there are also some transfer factors available, so you can choose the right supplement for the patient's immune system. Then we have the inflammation also causes some symptoms of the inflammation causes some symptoms of the brain. And this is sometimes, so you have to use that, you have to treat that, because it's really necessary to reduce the inflammation, because if you can reduce the inflammation, you will reduce also the symptoms of the patient. Yeah. So if we have some problems with if the patients have mental burning, we are using a low dosage of minocycline, which is really effective. Or we have also, there's also a nasal spray available, and in this nasal spray we have an extract of ginseng, and this is also really, really good working. And the other thing which is necessary to reduce the inflammation is to treat the pains. Yeah. We also use OPC, resveratrol, curcuma, and bromelain. We are using resveratrol, curcuma IV, which is really effective but expensive. And it is also necessary to use some omega-3 fatty acids. So we are able also to look which kind of omega-3 acids are necessary. Then we have the treatment of the pains. Yeah, it is very important to treat them. To treat the pains. So we have two big groups. One group is the pains of the musculus, of the muscles, and of the joints. And the other group is the neuropathic pain. And usually you have to use also different painkillers on these two groups. Yeah. And we are using some of these are the painkillers which we are using. We are using the novamine sulfone, ibuprofen, tilidin, LDN is low-dose naltrexone, which is also effective. CBD and THC, we're using cannabis oils, cannabis, I think since 4 or 5, no, more 5 or 6 years. And we are also successful acupuncture. Then sometimes we have to combine several kind of painkillers. So we can use also the antidepressors, which are amitriptyline or doxepin. We are using the anticonvulsants, which are carbamazepine, gabapentin, and pregabalin. Sometimes we are using substances like lorazepam and midazolam. Especially the lorazepam is very effective to cover if the patients are really anxious or they are agitated. You can really good cover it with lorazepam. Then if you have some problems with problems in the belly, the butylscopolamine is really effective. And PEA is a substance which is nearer to the endorphins. And you can also, so it's a natural substance, and you can also use it against pain. Some we have, a big problem is always MCAS problem, that is the activation of the mast cells. And so we also know that some of the infections have this as a side effects, like Bartonella infections has this, and we know that also mycotoxins based on mold exposure can do that. So we have the symptoms are burning inside the brain, that is vertigo, acouphens, which and hypotension, tiredness, and we have also the problem of tachycardia if the patients are going up. So it's the POT syndrome in English. Then we have the thing is you have to check it where the problem is. So we have several levels where these problems could be. So one level is the gut. So we have also producing bacteria, histamine producing bacteria inside the gut. And in this case, you can change the probiotic. So you can change the probiotic, but you can also use the DAO, which increase the metabolization of histamine inside the gut. We are using also the antihistamines, and we are using also we try to stabilize the mastocysts. So sometimes we have to do that before we should start with the treatment, because if someone has this problem and you start with a treatment and you increase the levels of histamine, it could be a disaster. Then we have also some experience that pollution, that heavy metals can increase the inflammation. Mycotoxin can increase the inflammation, as also problems of the detoxification, like the methylation problem, can increase the inflammation. We know that people with methylation problems have more problems with the Herxheimer reaction than other patients. If we know that we can do therapy with the right micronutrients, for example, liposomal glutathione, vitamin, the B vitamins, and 5-MTHF. We have sometimes, if we have problems with heavy metals, we are doing chelation therapy. We can do the chelation therapy as therapy with tablets, but we can also do it IV. And we can. Sometimes it's also necessary to treat the mycotoxins. Then we have the secondary mitochondropathie. Most of the patients are really tired. One of my colleagues in the US told me that he made some tests with his patients, and he told me that 76% of the patients are tired. So we have, and this is also a side effect of these chronic infections. So we have to give them, we have to support the mitochondria. We can do that with L-carnitine, taurine, magnesium, asparagine, rhodiola, ginseng, alpha-lipoic acid, ribose, and coenzyme Q10. And we have also some preparation where it's phosphatidylcholine in it, and acetyl L-carnitine with vitamin C and B1, phosphatidyl ethanolamine, also as that is also alpha-lipoic acid, some special glycolipids, and phosphatidyl inositol magnesium acid, alpha-ketoglutarate, and riboflavin, tocotrienols, and the PQQ and NADH. I like this preparation very much because it improves the energy of the people really a lot. But based on the sometimes, but you can not use it if it has, I think it's also Q10 in it. So you have to be careful with Q10 if you're treating Bavière infections. So nice. We know that phosphatidylcholine can detox the membrane of the nerves, and the PQQ is really good for to support the new production of mitochondria. And then additionally, we have also separate, sometimes you only can use a few agents on this side. We have also additional NADH, which will also support the production of energy in the mitochondria. Then we have that is also something which we see very often. We see along with chronic infection, we know the autoimmune reaction. So this we also know it from COVID, from post-COVID infections, and so the ANA is positive, and I think 20% of my patients have also Hashimoto disease. The therapies also to use to treat the underlying infections. Usually we don't use corticosteroids. Sometimes I use only in really small dosage if they have a tremendous inflammation. Then we have some troubles with the coagulation, especially we know it from COVID, from post-COVID, and we also know it from Bartonella, that it can help that you have some microthrombosis. So we are using, in this case, we are using lamprokinase, ASS, and heparin. With the help apheresis, I'm not sure, because I have several patients who have done the help apheresis. Usually it helps for a few months, but not on the long term. Then the Herxheimer reaction. For me, as a doctor, it's really nice if a patient has a Herxheimer reaction, because we tell the patients, then we know that the therapy is working. So usually you will get the Herxheimer reaction if the bacteria are dying. So the toxins which are inside, the toxins which are deliberated through the dying of the bacteria, this will cause a Herxheimer reaction. Usually you will get, the symptoms are getting worse, but some of the people will tell me that they have new symptoms. During the Herxheimer reaction, you have a lot of the cytokines inside the blood, but you have also the blood will change to the more acid side. So we recommend our patients not to stop with the treatment. So sometimes we change the antibiotic treatment, or we try to support the patient to go through that. So so our recommendation is, for example, to use alkaline foot baths. I like the lemon water, which means choice of one lemon in 1 glass of water, and drink it 2 to 3 times a day. We are recommending also some painkillers. And it's very important to change the body from acid to more basic, which you can, I will show you this later. You can do a lot over the nutrition also. Then we also give the patients treatment with supplements, and these are adapted to the needs of the patient. So we are changing the deficiencies of vitamins and minerals. Sometimes we are using also some amino acids, also adapted to the patients. As a therapy of the mitochondria, I showed you that. It is very important to improve the immune system, because one of the main things on this side is to improve the situation of the gut, or to take care of the gut. So we have to reduce the inflammation with this kind of supplements, and we have to improve the detoxification. And if that is very important, especially for people who are tired, it's very important to improve the quality of the sleep. So if you cannot sleep during the night, your immune system wouldn't improve, and you are tired during the day. But so this is like a circulus which you have, and it's very important to improve the sleep. I take a lot of care of this. Usually when we are not using sleeping pills, we are usually only natural things like 5-HTP, like some herbal stuff. We are using GABA, it's GABA. We are using also some melatonin, for example, but usually we try to avoid medication like sopliconol, which are really strong for the patients, or some benzodiazepines. Okay, and then I want to talk about the nutrition. So the first thing is to drink enough. It's very simple, but I mean no wine, but usually some water, some green tea is really good. But this is a good way to detox. Avoid white sugar, and to try to eat more basic, which means a lot of vegetables, a lot of salads, and a lot of and to avoid the flour, the white flour, and to avoid also to eat meat only 2 to 3 times a week. I prefer that the people will eat some meat, because we know we need the vitamins and the protein all out of the meat. The other thing is you can reduce the gluten, or sometimes you can also eat no gluten. But we know that there are some studies about no gluten, and we know that this is really good to reduce inflammation. But it's also a good idea to reduce the gluten. Which is the other thing, which is really really important, is to reduce the stress. We have often when you talk to the patients, the disease or the symptoms will start when they have some stress, some negative stress. So it's very important to identify the stress and to handle it. So maybe some of the patients have to do a therapy with a psychologist. I will show you that later. But it's also good to have some autogene training, qigong, tai chi, yoga, such things, breathing therapy. So this is really good to reduce the stress.
Yeah, sorry to interrupt,
Yeah.
Dr. Blehle. What do you mean by autogenous training? So entraînement autogène, is it self-training or something like this?
Yeah, usually it is possible to usually someone has to show you how it works, or how to do it, but you can do it at home. You can afterwards you can do it at home. Then the sports, I support the people to do sports, because we know that people who are doing the sports improved better than people who are not doing sports. So the new word is pacing, which you know, but we know that for a longer time. So it is very important to do sports, but you have to be careful when you are doing sports that you know when you feel that is enough, you have to stop with that and to do a break. Just a moment. We also recommend some physiotherapy, especially if people are sitting inside the wheelchair. So we have, for example, we have a physiotherapist who is doing aborde, but also Brücke is and craniosacral is possible. Some classic massage to improve the situation in the connective tissue, and some lymphatic massage, drainage. Yeah.
Just maybe one question about cranial massage. Crânio-sacré, j'ai traduit. I try to translate the best way I could. And what is it? Is it cranial massage, really?
Yeah, it's as usually you have it says that is the therapist will massage the connection between the cranial and the sacrum, which is the end of the spine. Yeah. One thing which is really more present than in the years before is electrosensibility. So we know that 4G and 5G is sometimes a challenge for our patients, also Wi-Fi. So the minimum what I recommend my patients is to reduce the exposition in the night. So there no Wi-Fi and no mobile phone inside your inside your bedroom. That's the minimum what you can do. If you have patients who have a burden of heavy metals, they are more sensitive against 4G and 5G. That is also something which is really interesting. So, but this is a challenge for us, yeah. And today it's nearly impossible to have a room or to have an apartment or a house without 4G, 5G or Wi-Fi. Then we have some problems. So the big question is, well, what is happening if the therapy is not working? So we have one thing is some problems on the level of the gut. So you have on the one side you have dysbiosis, which means that you have not the right bacteria inside the gut. So this can be a side effect of the antibiotic treatment. But it can be also, we have also some people who have, and the effect could be a SIBO syndrome, which means that you have the wrong bacteria inside the gut. And in these cases, you have sometimes symptoms which are similar to the symptoms of Lyme disease, like fibromyalgia. The other thing is also it is possible that you are not able to absorb the right concentration of antibiotics. So in this, so you have you can some, not all, but for some of the antibiotics you can measure it inside the blood. So the thing is, you have to adjust the dosage of the antibiotics, or you have to change the protocol to other treatments. And for one thing is you can give it the antibiotic, you can give it as IV, or you can give it as under the tongue. I showed you the different tinctures which we can give under the tongue and which are really effective on this side. Then we have you have to check for other things. So parasites is one thing which can be the reason. Then we have the candida toxins. We have the toxins of the mold, and we have also other toxins like cleotoxins, mycotoxins, for example, or cleotoxins. We have some organic toxins which are outside in the environment, and we have PCBs, plastifiants, pesticides, insecticides, herbicides, and I don't know all the toxins which are possible. So it's a big bunch, what could be possible. So, but detoxification is one important part of the therapy also. Then we have the HLA-DR, which means that these people are not, you cannot treat these people with antibiotic treatment. That is, and if some patients will come to the clinic and we have some problems and he tried a lot of antibiotic treatment in the past, we check this. And sometimes you can treat these people with herbal treatment, and you can treat these people also with disulfiram. Yeah. But this usually it's only valid for Borrelia. So sometimes you have some people who still have some effect of antibiotic treatment. But if we have some resistance against the therapy, that is one of the tests we are doing. Then we have the methylation problems. These people have usually more intensive oxamer reaction. And we have two genes. One is the C677, and the other one is the A1298. Our experience is that these people usually have a deficiency of the B active, the vitamin Bs, the bioactive vitamin Bs. And usually you can treat this really simple. It's just to support it, just to supplement it. Well, why it is important? We know that these people are not able to metabolize not only B vitamins, also other things, or they cannot do the right steps in the metabolization. So they make the metabolic side will do some detours, and then you have some results which you don't like. We know that, for example, people with MTHFR have some problems. For example, women who have MTHFR, it could happen that they have problems to become pregnant, for example. Then that's one of the newest thing, because we have some big problems on this side. So if the people have some problems, some pains inside the head, just ask them about about the teeth. Usually implants can be really can be a reason for headaches. And Nikos, and you have to check for Nikos, which are some inflammation and some osteolysis inside the maxilla, and you have to be careful. You have to think about that. So in this case, a dentist has to do his job. Then the next thing is if you have people who have a really bad traumatic injury of the soul in the past, you have to treat this. Our experience is that if you give them the best therapy which is available, it doesn't work 100%. So I have several patients. They started to do psychiatric therapy or psychosomatic therapy, and this supports a really good the treatment and also the success of the treatment. Then the post-treatment Lyme syndrome. My opinion is this doesn't exist. So I'm against the most of the other therapists. But our experience is that maybe if you have still symptoms after treatment, you have to look what's going on and what is wrong. So the people, maybe they have other illnesses. Problems of the methylation is one thing, and you have to look for mycotoxins, heavy metals, environmental toxins, or sometimes co-infections are not treated. There's also one other thing. So sometimes when we start with the treatment of Lyme disease and of the Borrelia infection, so after a while, the Borrelia infection is not so vivid or it's not so present any longer, but we have some of the co-infections are flaring up. So I have several patients, for example, then we see Bavière infections, and you have to see that. You have to notice that, yeah. Then that is one thing that's my opinion, because if you're a doctor, you have several functions. So on the one side, I'm a doctor, just for example, to take care of the therapy of the patient. But especially in Lyme disease and the co-infections, you're also a coach and you're also manager of information. We know that the coach is, as a coach, I will coach the patients through the therapy, because if you have such long-lasting therapies, you have to give them, you have to support the patient to go forward and until you will end the therapy. And manager of information is, we have a lot of information out of the internet. And I think as a as a doctor, you have to be familiar with this information, and you have to give a patient an idea, maybe is it a good or bad information. So we define the end of the therapy. So the thing is, the patient has no symptoms over 3 to 4 months. And also the lab tests in this time are negative. And we have at the end, usually I add some further 3 months of this phytotherapy to be sure that the people is at the end of the therapy. So then I have two case reports from me. So that is maybe today. It's also interesting. With COVID, we have nearly no patients who have only Lyme disease. So usually they have some vaccinations, they have some impact of vaccinations, they have some impact of COVID infections. So this is a 55-year-old scientist. He was vaccinated with COVID 3 times, and he has also an infection. But in May 2022, he has a tick bite, and he has erythema migrans. At the beginning, he got 2 weeks of doxycycline, and he improved a little bit. But then in October, he was extremely bad. He was lying in a bed. He was completely, his wife has to take care of him. He was not able to go to the toilet, for example, because he was lying in the bed the whole time. He couldn't concentrate, and he couldn't read a newspaper, for example. So when I met him, the diagnosis was Lyme disease. We find a diagnosis with borreliosis, and we find also Bartonella infections. We had no signs of persistence of the COVID infections. Yeah. Then we started with the therapy. He got antibiotic treatment from us, and we treat the inflammation. And at home, he has a physiotherapist. Yeah. And I think we start with the therapy, I think in November 22. In December, he was able to sit in the bed, which was really good. But today we have 24. So we started with antibiotic treatment, and we changed to phytotherapy. The concentration is completely back, which is really nice. And he's also possible to go to work and to do his job 100%. He's at the beginning, he was not able to walk because, for example, to go upstairs or downstairs was nearly impossible. But today it's no problem to do that, and he's also able to drive his car, and he can also go on the motorbike. And I was really astonished when he told me that, because this is really a challenge to go to the motorbike. And we are also treating children. So this is a patient who was 10 years old. He has a COVID infection in January 22. And he was when I know him, he told me that before he was a little bit, always a little bit ill, such thing, and he was always with his mother, and the mother couldn't do anything without him. It was so. And in July 22nd, 22, he got some pains in the belly. He was tired, and he was at home, and he has problems in the school. Then they also noticed that lymphatic nodes are present. He has muscle pains. He has problems. He has palpitations. He has problems with burning, and he has rages. Yeah. Then we made the tests, and the diagnosis was long COVID, maladie de Lyme, in this kind, Borrelia myomotori. Borrelia myomotori can cause also some abdomen, some problems in the belly. Bartonella can also cause some problems in the belly, especially in children. Bavière, chlamydia pneuma, and mycoplasma. And he was a really tough guy. He was here for 2 weeks. And he got antibiotic treatment. He got antiviral treatment, but only natural antiviral treatment. He made some ozone therapy. He was on the magnetic field therapy, and he get also some supplements adapted to his needs, especially against inflammation. So overall, he has 5 months of therapy, and in December 22nd, he was completely recovered. That was really nice, and it was really nice for the mother, because she told me, I have a completely different boy. He is playing with his friends. He's not along with. He don't want to be along with his mom, which was completely new for her, and it's a completely new boy. And now I think it's now nearly 2 years ago, and I didn't hear anything from him. So I think he is still in a good shape. Okay, that was my lecture. So do you have some questions?
Thank you first. Thank you. Vielen Dank, Dr. Blehle, for this presentation, and also for your treatments, for treating all your patients. That's impressive. So we have had a couple of questions in the chat. Donc on a eu des questions dans le chat. Et peut-être la première, c'est peut-être celle que vous avez posée, qui est, il y a beaucoup d'informations dans la présentation, comment on va faire après pour s'y retrouver, parce qu'on ne peut pas prendre toutes les notes. Et d'ailleurs, au passage, vous avez vu que la traduction simultanée, quand il y a des listes de médicaments, et en particulier de la phyto, c'est un peu n'importe quoi, donc il faut revenir sur les slides. So, Dr. Blehle, the first question for us is, people are saying, we have had a lot of information, but it's very hard to take notes of everything, in a very short time like this. So, yeah. Of course, there will be a replay available on this for a certain period. We have to talk about that, Dr. Blehle. And of course, it's a huge set of informations and medications. So maybe first questions, very simple. We start by the simplest, right?
Yeah, okay.
First is dapsone and disulfiram, for example. These are treatments we've been hearing, these last years. What do you feel? What do you think of these treatments? Donc, la dapsone et le disulfiram, par exemple.
Yeah.
Que pensez-vous de ces traitements?
We have about 100 patients on disulfiram.
Right now?
Yeah, at the moment, yeah.
Oh, yeah.
So, but we are using disulfiram when we are not successful with classic therapies. And it's the same with dapsone. And in dapsone, I tried the double dapsone protocol from Horowitz, but this was not possible with my patient. So what I'm doing with dapsone, I combine it with other antibiotics.
Okay. Another very easy question for you. What's the best lab test to diagnose? Is it ELISA, for example? So, quel est le meilleur test Or, another one, I don't know, pour diagnostiquer, est-ce que Elisa, elle la considère comme un bon test?
Yeah, we know that's a really good question. So the first thing is that we know that the ELISA, the classic ELISA, is only positive in 30 to 40% of the patients. And the Western blot is only positive in 50% of the patients. So, and the reason for that, we know that Borrelia can suppress the production of antibiotics. Of antibodies, sorry, not antibodies.
Antibodies, yes.
Yeah, and that is a problem. And then we have some other tests. We have the ELISA, the ELI spot. We have some fish test, for example. And my opinion at the moment is it's a challenge to find the best test. That's my opinion. Sometimes that is really sometimes I'm doing the following. I have patients who have the typical symptoms of Lyme disease, but they are negative in the tests. Yeah. Usually I try with these patients, if I'm convinced that they have Lyme disease, I will start the therapy for 8 weeks, and then we will repeat for a part of the tests. And in many cases, then the test will become positive. Yeah, I think the best test is if you have for example, you have a doctor and he knows or she knows, is it Lyme disease or is it not?
Okay. So your diagnosis is more oriented by, I would say, clinic examination. Yeah. Okay.
Yeah.
So, la question d'après, c'est y a-t-il des médecins en France qui peuvent prescrire ces traitements? So, do you think there are doctors in France who can prescribe these treatments?
I think I think phytotherapy is no problem. That is my information, but I don't know exactly what the situation at the moment in France, because I know that some of my colleagues of France, if they are prescribing antibiotic treatment for more than 3 weeks, that they will get a problem.
I confirm, yeah. Oui, on confirme que effectivement, les médecins qui s'écartent de la règle, on le sait, de la règle des 2-3 semaines d'antibiotiques avec un antibiotique, sont parfois, souvent, on va dire questionnés, voire plus, vous le savez, hein. Donc, y a-t-il des médecins en France? Nous, on peut dire de notre côté, avec l'expérience qu'on a, le retour des patients qu'on a, effectivement, en France, on ne peut pas prescrire, sauf la phyto, bien sûr, la phyto est disponible, phytotherapy, of course. So, les autres questions. J'ai une question sur Epstein-Barr virus en phase active. So, EBV, how do you handle it? And especially when it comes to, the lysogenic forms of, I don't know if you are familiar with this word.
Mm-hmm.
I'm not so familiar. So, and so there are several forms of active EBV. It depends on this type of replication. So how do you handle EBV? Do you treat it directly?
Yeah, so there are 2 parts. One part is to improve the immune system. It's also always a part of the therapy against virus. And the second part is in EBV virus. Usually I showed you the combination of several herbs in combination with high dosages of vitamin C and leucine. If this doesn't work, I use also antivirals, like abalacyclovir, for example.
Can you repeat the name?
Valacyclovir in high dosages.
Okay. So you use basically vitamin C, phytotherapy, herbal therapy, yes, as you said,
Yeah.
and leucine, and also antivirals. Have you had patients? It's a very specific question. Have you had patients with under treatment of tetracycline and malarone who develop, I would say, underskin pimps, I don't know how to, all over the body?
Yeah. So they have pimples over the body. Can you repeat your question?
I don't know, spots, not spots, but
Spots,
like bubbles under the body, under the skin,
we know
all over the body. And
we know that Bartonella can cause these spots on the body, but the other one, some of the Rickettsia species can also cause this.
So you think Rickettsia, we have to think about other co-infections like Rickettsia or Bartonella, maybe.
Bartonella, yeah.
Bartonella is very addicted to skin tissues. Okay. What form of Borrelia could you find, or what would you think of someone who is having a neuropathy, severe neuropathy with symptoms of little fibers?
I know what that means. It's a small fiber neuropathy.
Small fibers, yes.
Yeah. So usually if someone has small fiber neuropathy from the side of the Borrelia, I'm looking about Borrelia garinii, which is one of the species which is present in Europe. I also look at Bartonella infections, and I'm looking on methylation problems.
Okay.
So, and I'm checking the B vitamins, the bioactive B vitamins.
Okay. Connection between Lyme and electrosensitivity. So, connexion entre Lyme et l'électrosensibilité.
Mm-hmm.
Do you have an idea why Lyme is always, not always, but not always.
I think one of the reasons is that sometimes you have, with infection, you have a deliberation of histamine. And if you are sensitive to electricity or to 5G or so on, or Wi-Fi, this can increase the deliberation of histamine.
Histamine, you think is the
Yes, that's my opinion.
How is it linked to the waves? I would say, you know, it's a little.
We know that I think we know. I think at the moment we know nearly 200 different cases or not cases, causes of deliberation of histamine. Histamine is not only an allergy; it's only one of the cases. Yeah, so we know a lot more, and one of these cases maybe is also the electromagnetic radiation. Yeah, and so if you have on the one side you have an infection which can increase the deliberation of histamine, and you have additionally some 5G or Wi-Fi. This will increase the deliberation of histamine. It's very complex. Histamine is very complex.
Question about this young boy, this 10 years old boy who was your patient, who is still maybe your patient. Is he still taking phyto or anything? Est-ce qu'il a encore un traitement phyto ou autre chose, ce jeune garçon de 10 ans?
No. If you're at the end of the therapy in our clinic, we don't need any kind of antibiotic treatment or phytotherapy.
Yeah. And just one thing about this case, when you tell the case, you start by this sentence: always ill, or I would say very close to his mother's to his mother every day, every minute. So is it something that could be linked to Lyme as well?
I think that my opinion is about this case that maybe he has some infections before, but these infections were not so present. That is my and then we made the treatment, and we are treating also these infections. So the result will be that at the end of the day, he has no or the infections are gone, and he recovered completely. With there's another thing with children, which is really nice. If you have young children, you have a really high chance to recover completely.
Yes. Question about the probiotics. Are they all equal?
No. The first thing is usually we're using probiotic where the bacteria inside they're capsulated and not capsulated, but the deliberation of the bacteria is inside the, after the stomach. That is very important. So if you, some of the probiotics, if you put it in a glass of water and you drink it, and the probiotic is coming into the stomach, the acid of the stomach will destroy the probiotic. So you have to choose a probiotic which will the probiotic which will be deliberated in the after the stomach. So in small intestine or so on. Yeah.
And this form is encapsulated in certain components like phospholipids.
Yeah, for example.
Okay. Okay. So there's a question in English from Sarah.
Okay.
Does MCAs hinder full recovery, or do you manage to get good results despite it? MCAs, c'est donc le SAMA hein, en français, c'est le syndrome d'activation mastocytaire. Hein.
Yeah.
Et est-ce qu'il est... Donc la question c'est, est-ce qu'il est finalement, est-ce qu'on peut avoir de bons résultats malgré le SAMA sur ces maladies?
Yeah,
Is
the
it
thing
clear
is,
for you?
if you find the reason for the mast cell problems and you treat the reason, you can recover completely. For example, I have also some people who have a high amount of, or I have some patients who are allergic against a lot of foods. And when we do the treatment with, for example, with the infections, and we are treating the mast cells, this reduces for the amount of allergies reduces. Some of the people have no allergies at the end of the therapy. So, and there's also some other thing which is really interesting. I have some patients who had asthma, allergic asthma. And after they were treated, also this allergic asthma disappeared.
So you mean Lyme could be like, I would say, a shelter for these illnesses? A shelter, maybe it's not the right word, but
I think at a Lyme disease can cause that these diseases are worse than without Lyme disease.
Yeah. Okay. So these underlying, as you said, as you wrote in your presentation, these are underlying infections that are more or less hard to eliminate without tackling Lyme. Okay. Donc, j'ai du mal à traduire la réponse, mais bon. Have you got patients with adrenal disease? Lack of cortisol, in French, insuffisance des surrénales.
Yeah.
Is it a consequence of Lyme and co-infections?
It could be a consequence of Lyme, and sometimes this is also cause of tiredness. So in this case, the cortisol levels are low, and usually, if I find this, but it's not very often, but sometimes we have this. So we support the adrenal gland with some hormones from external. But usually we only do that as long as necessary.
Okay. So we have a couple of other questions. One is maybe not so easy for you to answer, but neither for us. Donc la question, c'est les malades avec limite financière nous demandent à nous, l'association, quoi faire quand les protocoles pas chers échouent. So, you know, the patients with who are not really wealthy, they keep asking us, what can we do when the low-cost protocols are unsuccessful? What could we do? Because, you know, just to say a little bit about it, but the phytotherapies are certainly costly.
Usually, that's the first thing. What my aim is usually to make it possible for the patients, also from the side of the money, to do the therapy. So I'm very careful, for example, to do some tests. Only at the beginning, we need an overview what's going on. That's the first thing. And the other thing is usually I'm very open to that. If my patients told me I have not so much money, so we try to do the best or to create the best out of that. Usually, in this case, it will take it lasts longer than if we have all options. But usually we try to do that for the patients.
I understand.
Yeah.
Another question about the HLA. So,
Yeah.
HLA-DR. HLA-DR, c'est en fait un typage lymphocyte, enfin, pas lymphocyte, un typage, pardon, génétique, pardon, qui est, on l'a vu tout à l'heure dans les slides, on le sait, qui est favorable, on va dire, à l'arrivée de maladies auto-immunes. Donc, do you do genetic testing for HLA-DR before starting treatment?
Sometimes, yeah. For example, if the people are coming to the clinic and they pass several therapies before, then we check it before. We first, because then we want to know, is it still possible, for example, to treat the patient with antibiotic treatment, or is it necessary to think for another treatment?
Yeah, you're talking about HLA-DR, but not HLA-B27, for example, which is likely positive.
Different.
And there are lots of people who are, who have rheumatoid issues. Donc, je parle du HLA-B27, qui est aussi un autre, tous les HLA, donc c'est le typage du système immunitaire. Et en fait, certains sont effectivement propices aux maladies auto-immunes ou aux maladies auto-immunes plus spécifiquement, par exemple, c'est le cas de la HLA-B27, des maladies auto-immunes sur les articulations. Donc, so HLA-B27, what do you think?
And usually we don't do this test, only we have a suspicion on this. Maybe it's the other thing what I want to tell you is if a patient is coming to the clinic and he has old results from the last years, please bring it along, because we studied these results before the first appointment, just to see which kind of tests are made and what is really necessary.
Okay. We have a long question by Ocean, but it's a personal case. I don't know if we have the time to make a full consultation, but well, so I read it simply, and you say whatever you want in a couple of seconds, but we don't have like 2 hours, I'm afraid.
Okay.
I was already diagnosed. I got 30 days of doxycycline and then done. And I still have many complaints. And on top of that, I got COVID 2 times. My doctor feels like the work is done. It's done now, but I still have a low quality of life. How do I go further in the treatment steps? There seems to be a wall where there are no any other treatment options and or any follow-up for anything chronic. I don't know how to get help from my doctor for this. So again, maybe in a couple of seconds.
So maybe I can give you some ideas. So the thing is, if you usually if you got doxycycline for 30 days, maybe it's good to have doxycycline for 30 days. So it's really rare to get doxycycline for 30 days. But and you have COVID, but if you are still bad, if you are still feeling worse, so my idea is, for example, my recommendation is maybe to visit a doctor who is familiar with this kind of infections, and maybe to do some further tests. I think if you're still worse, that there is still something.
Okay. Another question again about ELISA tests. Olivia, she says, I've been positive 6 times. Do you think if we are positive to ELISA test 6 times, we have Lyme, or it could be a false negative? So question is strange. Is it false positive or negative?
Usually not. Usually, and the other question is she positive for IgG or IgM or both? That is a big question. So we know that some of the people can stay on positive IgM for years. And our opinion about that is that there is still some cyst forms inside the body, which causes some kind of symptoms or some kinds of problems. So it depends, is the IgM positive or the IgG is positive. There's also another experience. If you have, some of the patients have negative IgM tests, but the IgG is highly positive. So you have high levels of IgG. And our opinion is that in this case, you have still some problems, that in this case, Lyme disease is still present.
Okay. I have another question, which is about the numerous medications you listed. So, donc à propos du nombre très important de produits, de médicaments et de phytothérapies qui ont été listés, la question est, so many different medications in your presentation, how do you decide which one you take? Because you said we have a catalog of like more than 100.
Yeah. It depends.
And it's frankly speaking, it's really spectacular. It's impressive. So how do you manage to get, first of all, I would say, the memory of all these medications?
Okay.
And how do you make your way?
Yeah, usually the first thing is that we are always searching for good supplements or for good medication for the patients. We are searching worldwide about this. That's the first thing. And the other thing is that we adapt this kind of supplements or this kind of phytotherapy to the needs of the patient. So if we have, for example, a positive test for Borrelia, we are using some of the supplements, not all. The other challenge is it is necessary to not to use too much supplements, because on the other side, for me, it's very important that the patient can take his therapy. And if so I have some patients, they told me, oh, it's nice to have this plan, but it's too much for me. Yeah, so, and this is for us, we try to find a way for the patient. Yeah, so, but what we choose is dependent from the needs of the patient and it's dependent of the results of the lab tests.
Okay, maybe the last question, is it frequent for patients with chronic Bartonella symptoms to have negative results to all kinds of serology tests? In such cases, do you adapt treatments exclusively to symptoms?
The thing is, usually I'm doing the Borrelia as the Bartonella antibodies. That's really rare because in the most cases these are negative. So I use the ELISpot for these patients. Mm. And sometimes, for example, I showed you the case of the scientist. At the beginning, he was negative for Bartonella, and after 8 weeks of treatment, we had positive results.
Yeah.
So,
yeah, because at the beginning, he was not able to produce antibodies, yeah. Right?
If you have a weak immune system at the beginning, some of the tests are false negative.
Très bien. Donc, je crois qu'on est arrivé au terme. On a un peu dépassé. On aurait sans doute beaucoup d'autres questions. Je pense qu'on a fait un tour de pistes intéressants sur la maladie grâce à vous. Vous remercie beaucoup chaleureusement, Dr. Blehle, de votre temps. So thank you again, Dr. Blehle, for your time and your patience, and thank you for what you do. And it's a hard job to be a doctor like you. We know that, of course, all the cases you have are of course severe cases, and it's not always easy to make the right treatments and that to have results. So thank you again for what you're doing. Thank you again for this conference, and merci à tous pour votre participation. Maybe the last word for you, Dr. Blehle.
Thank you very much for the invitation. And I want to know that I like my work. I love my work. I love my job, and I always try to find the best ways also, or to develop the treatments, for example.
Merci encore. Vielen Dank.
You
and
did.
have a good evening.
Yeah, thank you very much.
We keep